And joining me now is a very familiar face these days in this crisis. It's Dr. Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome back to Meet the Press.
Good to be with you, Chuck.
Let me start with the testing issue, and I start it with there because I feel as if we're on repeat. Right. Every week we're told, no, we're ramping up, and every week we don't ramp up. Yeah. Why should we believe that this is the week that this is going to work?
Yeah, Chuck, I think the reason is because we've really made somewhat of a sea change here. Before, I mean, obviously, early on, we weren't in the situation where we could actually get the test out in a broad way. And I mentioned on the show last week that we need to get the private sector involved. And just a couple of days ago, we had the CEOs there who are going to be now putting it on full overdrive. So I would expect that very soon. When I say soon, I'm talking about days to a week, where you're going to start to see it go up like this. Not everybody tomorrow is going to be able to get a test, but pretty soon you're going to see a major escalation of capability and implementation.
I just want to point out, and this is just one example, Steve Peoples, he's a reporter for the Associated Press. He shared his experience. I'm presenting mild symptoms, headache, mild fever, mild cough. I want to get tested in North Jersey. Primary care tells me to go to ER. ER tells me to call City Health Department. Health Department tells me to go to urgent care. Urgent care tells me to go to ER. And everybody says no test.
Yeah, that's right. And you're going to hear about that even a little bit. You're going to hear individual ones. But as a group, it's going to change, Chuck. It really is. Because once you get the heavy hitters from industry and private sector involved, they're going to be able to make it go.
What's realistic about the spread of this virus right now? And we've had, Governor Mike DeWine, who's going to be on the show later. He goes, well, yes, we only have 26 confirmed cases, but his scientific advisors assume there might be 100,000 people with it in Ohio. Is that a fair estimation?
It is. The nature of outbreaks are that you percolate a little bit along, and then you reach what we call an exponential fade. If you look at every curve, Chuck, it does this, and then it goes way up. And Italy is an example of individual country that did not implement the massive type of containment and mitigation, and it went way up. So they're here now. They're really struggling. Our goal right now is that if you do nothing, it's going to do this. We're going to get more cases no matter what. What we need to do with containment and mitigation is to blunt that curve, because left to its own devices, it's going to do this.
How do you know when this curve is blunt? And do you have any evidence that we're blunting it?
Right now, well, I'm sure that we are with what we're doing, but the numbers don't tell us that yet. So what's going to happen is that if it goes like this and continues and doesn't come down, if you have a mound, you've done something, but you don't know about it until after the fact. On any given day, you can't say, oh, we've blunted the numbers, because the numbers are still going up no matter what you do. Right. It's how much up they go that is the issue.
I guess the question is, are we taking these precautions that you and others have said seriously? I don't know if you've seen overnight these pictures at various airports as people scramble to come back from Europe. Stuck. I mean, look at these crowds in O'Hare. You had crowds in Dallas, at Dulles, and these are people, because of this worry, they want to get back into the country from Europe, and they're being jammed together. Yeah. This is the federal government. The governor of Illinois basically said, look, we can't do anything about this. This is the federal government. What went wrong here?
No, I don't think anything went wrong. I think it's just the nature of the problem. When you have a situation where people are in different countries, that there are going to be restrictions, American citizens, their family, others, permanent residents can get back. They don't need to immediately get back because they think they're going to be left out.
But they came. But that's what they did do.
That's what they did, but they're not. They will be able to get back. When they do get back, they're going to have some enhanced screening, depending on the country. If you're in the European group, if you're now with the UK and Ireland, what you're going to have is you're going to have 2 weeks of self-imposed isolation.
Italy, you've brought up Italy a few times. I want to bring up a story here in the Boston Globe where one Italian journalist shared the following remark, and it just said, many of us were too selfish to follow suggestions to change our behavior. Now we're in lockdown, and people are needlessly dying. This is St. Patty's Day weekend. There's been plenty of bars and restaurants. They're crowded. Is this a mistake? France just shut it down. Spain is shutting it down. I think Pennsylvania's thinking about doing this. Should the country shut down bars and restaurants?
Well, you know, that's an individual question. What the country should do is absolutely, and more so proportionately, in those areas that have community spread. But as a country...
Well, what areas don't have community spread right now, Dr. Fauci?
You know, I mean, real obvious community spread. So the question is that you want to bring down and hunker down everywhere, even more so. I'm not saying the rest of the country's okay, don't worry about it. Everybody's got to get involved in distancing themselves socially. If you are in an area where there's clear community spread, you have to be much, much more intense about how you do that. That's where you get things like school closings. You don't want to close every school in the country, but there are areas.
Why don't you? And I ask this because do you worry that if some places do a lockdown, but some don't? I think Indiana is one of every state that touches Indiana has closed schools, but Indiana hasn't, for instance. So are you risking something if not everybody is following the same guidelines? No,
Chuck, you always want to be ahead of the curve. I mean, the golden rule that I say is that when you think you're doing too much, you're probably doing enough or not enough.
Okay.
All right, that's the thing you've got to do. You don't want to be complacent. You always want to be ahead of the curve. But it depends on how far ahead of the curve you want to be. Don't even for a second think that I'm saying we shouldn't. I like to be criticized when I say, oh, you're being too overreactive. That's good for me, right?
Let me ask it this way. We've had a healthcare official say this to us, that if we could guarantee that people would get their sick leave pay, guarantee that we could basically do what FEMA does in a natural disaster, give people cash for the basics, for groceries. And would you prefer a 14-day just sort of national shutdown to slow this down?
You know, I would prefer as much as we possibly could. I think we should really be overly aggressive and get criticized for overreacting.
Okay, have you made this point of view known inside the administration?
Yes.
Is it getting pushback, or are they slowly getting there?
In fairness, they listen and they generally go with what we say.
So should we expect more closures? Should more Americans be prepared to be hunkering down at their house?
I think Americans should be prepared that they're going to have to hunker down significantly more than we as a country are doing.
That means no restaurants, no bars, things like that?
Chuck, when you say no...
Yeah, I hear you say no.
You know,
unlikely. I mean...
Much more so. I mean, obviously, you're going to have people who are going to go to restaurants anyway, but for the most part, and particularly, if I can say this is particularly appropriate and relevant for people at the higher risk. The elderly and those who have underlying conditions right now should really hunker down.
Have you seen the reports out of France that they've had quite a few patients under 50 have some serious underlying conditions with coronavirus? Does that tell you that maybe we've made some assumptions that aren't true? No, actually, if you look, well, I wouldn't say that are not true, but the fact is, from the data from China and the data from Korea, we've seen a very, very, very small percentage of people who are younger. As we start seeing new data of younger people who are getting in trouble, we want to look at that data and also look at the virus to make sure the virus hasn't changed. Are you concerned that younger folks, because we've all told them, you're going to be fine, maybe are not practicing as much social distancing, not realizing they can be spreaders?
I think they should be practicing social distancing because even if, and I think it's still true, that younger people are at much, much less risk of getting into trouble, that doesn't mean they're not going to get infected. And then they are going to infect the older people. So everybody should be taking really good care to avoid infection.
All right. And the final thing I want to ask you about is our hospital preparedness. The ventilator situation and the respirator situation both seem to be potentially dire if we don't flatten the curve. How concerned are you?
Well, if you have a really massive increase in cases, there's no country or anybody in the world that's going to be perfectly prepared. But we have a stockpile, and we will hopefully be able to backfill and refill that stockpile. But I think people should remember that's the reason why we want to blunt that curve. If you let the curve get up there, then the entire society is going to be hit.
Should all elective surgery be postponed right now?
You know, for the most part, elective surgery, keep people out of the hospitals except those who need to be in the hospitals.
And if you think you have symptoms, don't go to a hospital, correct?
Don't. contact a physician, contact a healthcare provider, and get some instructions about how you can get tested. But stay home.
All right. And final question is this. I want to show the picture of the briefing yesterday. Are you guys practicing enough social distancing? You know, at the time, the president was being tested. But, I mean, you looked up here, and a lot of us were going, wait a minute. We've been told not to be in a crowd that small.
Right. You know, a crowd that small, but sometimes there's business that you need to do. But I'm working on it, Chuck. I'm working on getting everybody to do this. I hope I'm successful.
Elbows out. Dr. Fauci, I know these have been some long nights, some long days. Thanks for coming on and giving us more information.
Always good to be with you, Chuck.
I have a feeling I'll be seeing you soon.
I think so.
All right. Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.